Welcome to the PA Insights podcast, powered by NCCPA. Today, we're talking about one of the most fast-paced and demanding specialties in healthcare, emergency medicine. Every shift brings new challenges, rapid decision-making, and the opportunity to make a meaningful difference in patients' lives. As emergency medicine continues to evolve with advances in clinical practice, growing patient complexity, and expanding opportunities for PAs, staying informed has never been more important. In today's episode, we're joined by two experienced emergency medicine PAs, Sara Champoux and Tenell Zahodnik. We'll discuss key findings from this year's Society of Emergency Medicine PAs Conference, also known as CIMPA, and the value of earning NCCPA's Emergency Medicine Certificate of Added Qualifications. We'll also hear practical advice for PAs interested in the specialty and wrap up with a fun conversation about how television dramas, such as The Pit, compare to the realities of working in the emergency department. So let's jump in. All right, I want to welcome Tenell and Sara to the PA Insights podcast. Thank you both for joining us so much today. I wanted to start out by asking, could each of you share a bit about your background and what specifically drew you to emergency medicine? Sara, I'll start with you, and then Tenell, we can go over to you.
Great, thank you. I've been an emergency medicine PA for over 20 years in Scottsdale, Arizona. I'm the current CIMPA president and vice president of APPs for Envision. What drew me to emergency medicine? I was working in family practice and realized I kept being drawn to those type of patients. I was actually more excited to be able to send somebody to the emergency department or call over and see what was going on a more ill patient, as well as the procedures. And so I realized that perhaps I was needing to shift my focus. And so I switched over to emergency medicine after working in family practice for a while.
And Tenell,
Hey
how about
everyone.
how about you? What sort of drew you to this field?
Well, my name is Tenell Zahodnik. I am originally from San Antonio. I currently work in Abilene, Texas. And my kind of journey here is a little bit different. This is my second career. So I did marketing and sales before I had a big overhaul with my life and went to PA school. And it's kind of funny because when I was going through my rotations, I used to tell everyone I was open to anything except urology and emergency medicine. So I actually was terrified of EM. It kind of was overwhelming, but I got a really great job opportunity. And when I was kind of looking at the possibility of going into emergency medicine, I liked the idea of, when you graduate from school, you have all of this knowledge. And so it was a great way to see a whole bunch of different pathology right out of school to kind of help solidify some of that information. And I liked the idea of an undifferentiated patient coming in and having the puzzle of trying to like figure it out. And kind of like what Sara said, I really liked the hands-on aspect. I wanted to keep up my skills. And so I'm a little bit newer than Sara with her experience, but I am coming up. November will make 10 years that I've worked in emergency medicine. And that's all I've done since I graduated.
Wow. I want to specifically talk about kind of like what your favorite thing is about practicing emergency medicine. If you both have one off the top of your head, just because it seems like, we were kind of chatting beforehand of like, there's no typical day in emergency medicine. It's changes every single day depending on your patients. But Sara and then Tenell, like what is it that is your favorite part of doing this job?
Um, Favorite part of doing this job is probably the satisfaction of knowing that you helped someone every day. My favorite actual thing to do is probably reductions, whether that be a dislocation or a fracture. It's so hands on, it's so immediately gratifying, and you can see this improvement of results. So I tend to lean toward those when I see some of those orthopedic things come in. I will often pick up that patient pretty quickly.
So for me, I really found kind of and this wasn't in my first, the first year you're like not sleeping, you're terrified that you've missed something. So once I got over that initial like eternal GERD and kind of settled in, I really found that I enjoy trauma kind of as a whole. I find like approaching trauma, working traumas up really to be kind of fascinating. And I really have an affinity for like infectious disease. I kind of think sepsis and trying to find sources and things like that is really, I enjoy that. That's a weird statement, right? Like, you could only say that to other medical
You
people,
know
like,
what? I'm
"You
sure
know what
there's
I
tons of
like?"
people listening who probably feel the same way. So,
Yeah, we're all just, EM, we're a little dark and twisty, so that was a weird sentence, but you'll know what I mean.
so emergency medicine is something that's like always evolving. I'm curious, what are some of the biggest changes you guys are seeing right now in the emergency medicine field?
Um, I'll start with that perhaps. Of course, the first thing that comes to mind, like everything in our world, is think AI.
Mm,
There's so many ways that it's being used in medicine. We're using a lot of ambient scribe technology and ambient listening to help us with documentation, and I think that's really something that's exciting for a lot of us that spend so much time on in that EHR and charting. But we also are looking at programs to see how can we better help with patient flow and get patients through the department. Are there better ways? Are there algorithms we can use to make sure that we're taking the best care of patients? Open evidence is really common to use. We're using a lot of programs. I think many of us are finding where can we turn to when we want to just brush up on something maybe we haven't seen or look to see if there's a new treatment regimen.
No, I mean, I think that really hits the nail on the head. I think what's interesting too about what we're seeing with AI is also, I think it's also kind of shaping different patient interactions that we're having because patients are coming in and saying, I put all of my symptoms into Chat GPT and I think it's this. And so it's been fascinating to see it on both sides, how AI is kind of giving us new tools that we hadn't had before, but it's also giving patients different things. So then it's kind of a weird middle ground of trying to watch, those things come together. I think also kind of speaking on throughput, I think that something that PAs and EM systems have been really good about is looking at how to utilize PAs in a really effective manner for things like throughput. Boarding is a huge problem across the nation, and I don't know of a single department really that's not facing that. And looking at, are there ways that we can be more effective? We have things like providers and triage. We even have people who are doing work in the pre-hospital space with like EMS of getting, PAs out there and seeing people actually before they even hit our doors. So I think there's just it's an interesting time right now to be in emergency medicine and see all of these different developments kind of come together and make EM better.
yeah, I mean, aside from AI, are there any other, whether it be clinical approaches, tools you guys are using, or even just workflows that are helping reshape the way you guys do your practice?
I think in some ways it's difficult because you kind of have to know a little bit about everything when you're in emergency medicine. You have no idea what's going to hit the door, and it can change minute by minute. And I think really I think the bigger thing is just making sure that you're always learning. There are different resources that I use on a regular basis to try and make sure that the knowledge that I'm applying is evidence based and it's the most current knowledge.
I
Sarah,
think
how
the
about you?
only the only other thing I might add on that is just thinking about the different ways that we can take care of patients. We have teletriage now in some of our emergency departments. We're thinking about how can we get triage to patients faster and quicker. Tanel earlier mentioned provider in triage, and that's really common, but thinking about how else can we better care for our patients? Is there better ways for follow-up? Can you give different instructions? How are we able to get to patients in different ways? And so I think the exact model of the patient just shows up in triage and sees a nurse and then waits is changing. And I think PAs are a big part of that. And so I'm excited to kind of see the direction that we're going with that as well to help bring care faster and better to patients.
So, you both recently hosted the annual SIMPA conference. I'm curious as we transition to that, what were your biggest takeaways from this year? Tanel, we'll start with you.
Well, I mean, full disclosure, I'm completely biased. So I'm the conference co-chair along with the ever talented Josh Higgins. But I will tell you, when we plan this conference, we're really proud of this educational offering. And our goal is that when people come to the conference, that there is going to be a skill, a new piece of knowledge that you can take to your very next shift and apply it on the very next shift. And I think we did a good job of that. It was really neat to see some of the top emergency medicine speakers from around the country come in and be on that general session stage teaching us and then having the opportunity for breakout for hands-on. And honestly, emergency medicine PAs know how to have a good time. So we had some really great social events. We actually had a party on the grounds of the Alamo, which was really awesome. But I think it was cool to see also just a spectrum of PAs that are at different places in their careers. We had brand new grads who have been in emergency medicine for 7 minutes and are trying to just soak it all in. And then we have PAs who have been practicing for 25 plus years. So kind of seeing that networking event as well was just cool to watch, all of the different ways that PAs are impacting emergency medicine. So I think that it was a really successful conference. And I was thrilled when it was over, but we were really proud of the way it came together.
Sarah, were there any speakers or any sessions that really stood out to you or stuck with you from the SIMPA conference?
The SAPA, the Society of Army PAs president, Travis Kaufman, did a wilderness medicine talk that really stood out to me. It was very intriguing to think of a different way to use our skills outside of perhaps the walls of the hospital and really thinking about all the ways that emergency medicine impacts our patients and the ways we can care for patients. And so I think probably those two stood out to me the most.
So let's talk a little bit about CAQs. This is an NCCPA podcast, and we do have the emergency medicine CAQ. Tenell, you've earned the emergency medicine CAQ. I'm curious, what motivated you to pursue this one?
Um, so, for me, I came into emergency medicine as a brand new grad. It can be good Lord, that learning curve is like Space Mountain. It's very aggressive, right?
Hmm.
And for me, it was honestly, part of it was it was a pride thing because I wanted to differentiate myself and to really work towards something because I came in just going like, oh my goodness, you don't know how much you don't know until you're out there. And I liked having kind of a set of like steps of something I could work towards, which I really appreciated. At the time when I was starting on my team, only one other person had their CAQ and EM. And so I thought this is a really great way to kind of continue to advance my own emergency medicine knowledge and to also kind of start, leading my team towards like, this is a really great thing for us to earn, which now on our team, whenever we hire um, EMPAs, we kind of say like, "Hey, it's an expectation of us that you're going to start working toward this because we think it is so important."
So let's walk through the process a little bit. I'm curious what PAs should expect out of getting the emergency medicine CAQ and how manageable it is alongside a full-time ED schedule.
That's a great question. So what for one thing, there is an hour. You have to have a certain number of hours before you can start, which for emergency medicine is 3,000 hours, patient hours. And so, I think that's great that you can kind of get in there, start doing emergency medicine, and say, "Hey, I want to work towards my CAQ." So you actually start the application process, which there is a very nominal fee to begin that. And the nice thing is you have a really long time to get this done. I think it's like 6 years to actually get all of the check marks. So I really like that there's a really long runway that, if you need to take your time, great news. The NCCPA has allowed for that. There are certain CME requirements where you have to have a certain number of CME that's specifically in that particular field. And then other things is there are some sets of courses you need to take, like PALS, ATLS, an airway course which for me, that was great because quite frankly, I had to have those for my job anyway. So that was kind of a two birds, one stone kind of situation. And then there is an attestation form that either a supervising position or your lead PA or someone, that's in leadership on your side can attest to your ability to do certain procedures and know when to apply those procedures. And then there is an exam. I think it's like 120 questions, nothing just, nothing outrageous. And so I think it was a very manageable process.
Mhm.
Because quite frankly, you're already out doing these things. You're taking these courses, you're seeing these patients. So I never felt like it was adding too much to my plate. It felt like honestly, I was already working towards it. So I liked that there was kind of some very nice parallels there.
And Sarah, correct me if I'm wrong, you recently renewed your CAQ, so I'm curious, how did you approach the whole renewal process?
Yes. So It snuck up on me a bit. As Tenell mentioned, you do have several years in between these, but of course, time flies. And I didn't realize that there was an online option, and probably better for me. I maybe focus a little bit better just going to a testing center. So I did like that there was at least the variety, which initially there had not been. But I actually found the prep pretty enjoyable because it's so relevant to our daily practice. As Tanel mentioned, this is what we're doing every day. So I didn't find that I had to spend a lot of time, just direct study time, because this is covering our day to day. I just put a little more attention into some areas that maybe I don't see as much. Sometimes a lot of the facilities I work at, they don't have as many pediatric patients. So maybe I knew I needed to focus a little bit more for pediatrics or some other presentations of things that maybe I hadn't seen recently. But overall, it just wasn't as stressful as perhaps I had anticipated it was going to be. Because as I was looking at it, I realized, oh, this is what we are doing. So it was overall a pretty smooth process.
I'm curious if you guys can talk about how important it is that the CAQ is developed by emergency medicine PAs themselves and how important it is to have that kind of peer driven approach in shaping this exam.
I think that's incredibly important to know that, our peers, our colleagues are the ones that are really helping set the bar. I mean, because you want to know that what you're buying into is something that our own profession has created and has vetted. One of our board members, J.R. Rosenblum, was actually invited to help, came out with the NCCPA and was kind of used. I know that they were bringing in PAs from different fields and kind of using them as like subject matter experts to validate the questions. So I love that it's not, some, random C suite of people who aren't clinically doing what we do, creating these questions without any type of metric for what's relevant. So I that's really important to me, is to know that this is looked at by PAs who are doing this, to say, yeah, this is a great test of what we should know.
And Sarah, I mean, for PAs considering it, what value do you think the CAQ adds both professionally and in terms of patient care?
I like the confidence that it gives. I think that we maybe don't realize how much we know. And I think that being able to take something like the CAQ and say that you have that is really just it's a feather in your cap. I've described it to patients before when patients say, "Well, what do you mean? I don't understand how a PA can work in emergency medicine. Where's your office?" And so I've been able to describe it to patients, maybe if they have a little bit of hesitation. I'm also fortunate enough that I have a leadership role, and it's something tangible that in my organization we can give to the physicians. And when we're talking with physicians from other organizations, when they're thinking about what is the best way to utilize a PA, how can we ensure that PAs are really just impressive practitioners that are going to take great care of patients. I think being able to lean on that CAQ is really important. And we've had some really good responses from our physician colleagues when we talk about this as kind of an added level um, of credentials, basically.
And what are your thoughts on the CAQ blueprint? Like, did you feel it aligned with the real world practice that you were doing?
Absolutely. I needed a little help in deciding where to go. It's a big field. You don't know where to start, and so knowing where to start off directing your time. I personally, I get up with caught up in some of the details. I'm a very detail-oriented person. Sometimes, like all the different diagnoses of dermatology will weigh me down a bit, and so seeing that dermatology was a little bit lower helped me focus on other areas a bit more. And then I was able to also refer back. I looked at the blueprint and said, oh, there's a legal and ethical section that reminded me it's not all clinical diagnoses and really was covering all aspects of care. So it really did span what actual practice entails, kind of the whole gamut. And so I actually liked being able to refer back to the blueprint. I do think it helped me as I was trying to focus. I remember initially, but definitely more on the recertification.
So let's talk a little bit more about that kind of real world practice and growth. Emergency medicine often requires stepping into very high pressure and often unfamiliar situations. Sarah, can you talk about experiences working outside of your usual comfort zone in emergency medicine?
Well, isn't that what we all love and enjoy? So, I think that's why we're here. But I have a quote I like to run, and there's was an Olympics. distance Olympic runner who once said, "You don't train to not feel the pain, you train to know you can get through it." And I actually think of that. It's very similar to emergency medicine. We lean on what we know, we train to be able to deal with those situations, and something will be related to a piece of our knowledge that we've already worked on or we've already done. And so you lean on that. I tell new PAs and new students, it's good to feel uncomfortable. It keeps you on your toes. It makes you keep thinking about what could I be missing. And it's not a bad thing. People think of this feeling, this pressure, something unfamiliar as being a bad thing, but I really don't think it is. I think it's a really good thing for us in emergency medicine.
Yeah, Tanel, I'm curious, do you have any skills or just is there a mindset that helps you adapt and succeed in those moments? Because I could see you nodding as we were
Yeah.
talking about, like,
I'm like,
it's
yes,
it's
girl,
different
all of it.
every single day.
It is. And, that's what, we're kind of adrenaline junkies that you don't know what's going to hit the door. But, so one of the other things that I do is I'm an assistant professor for a PA program here in Abilene, Texas. So I precept a lot of students. And so I also, you can also see their little eyes just, almost pop out of their heads when they get the opportunity to do something. And so I guess we're big quote people, Sarah, because I also have a quote. But if you saw that movie, We Bought a Zoo, there's this quote which had nothing to do with medicine, but he talks about like sometimes all you need is 20 seconds of insane courage. And I remember, especially in my first year, stepping up to things where I felt completely out of, goodness, over my skis, out of my comfort zone. Like, what in the world? You have imposter syndrome sometimes. And I constantly remind myself, like, I need 20 seconds of insane courage to step up and intubate this patient. And that's something I tell my students too, is like, hey, yes, like feel it, feel that. That's, I do agree that kind of that you're not growing if you're completely comfortable. But sometimes it does take just 20 seconds of deep breathing and we're going to be very brave here and do this thing. So
I like that. I may steal that, by the way.
you absolutely can. You absolutely can.
So I wanted to transition to something kind of fun. One of my television obsessions this year, and really the last couple of years, has been watching The Pit. And I'm
You and
curious,
everyone else, Jesse. Yeah. You and
along
everyone
with
else.
everyone else. Look, I bring it up to some people, and they're like, "Do you want more stress in your life?" And I'm like, "Yeah, yeah, sure." But I'm curious. That show is so popular and has been nominated for awards. Like, from your perspective, working in emergency medicine, what do they get right on that show about what it's like to work in this field?
So honestly, I think they do such a great job. And I think that the pit, they have made it an important standard for themselves to bring in EM consultants to make
Mhm.
sure that it's accurate. Um, and I got to tell you, it's really cool to watch people rally around this show and be so fascinated and interested and emotionally like invested in this show because it there are so many things that are incredibly accurate and also incredibly poignant. And even, Sarah and I have had some conversations. It's given, people a lens to really understand what emergency medicine is, even our families. If you're not doing these shifts day in and day out, sometimes it's hard to relay what you just did for the last 12 hours. And so giving people, insight to what our jobs can be is just it's been really cool. It's been a really cool time to see the pit flourish the way it has.
Sarah, are any chances Simpa is advocating for more PA representation on shows like The Pit?
Well, there's always room to advocate more for PAs everywhere. So, of course, yes. Um, one of the things that I had thought of in particular when I've been thinking about the PAs in the pit, and there isn't a character specifically that's portrayed on screen, but there is a PA who is on the advisory board, and she's worked on a ton of medical shows. And so I think having her on the board keeps it realistic and maybe keeps the mind of the characters and the writers and the other advisors that PAs are a big part of emergency medicine. I think and hope that probably that there might be an opportunity in the future for maybe a new character that could be an amazing PA that could be accurately representing how much we really do and how we contribute in emergency medicine. So, yes, absolutely. I think making sure that emergency medicine and PAs are represented appropriately, SEMPA is definitely advocating for that all the time.
Noah Wiley, if you're interested,
Hey,
here's
well,
your
no,
opportunity.
feel free to reach out.
So let's wrap up. I'd like to hear from both of you. What continues to inspire you about working in emergency medicine right now?
Oh, I'll jump on that one first if you don't mind, Tanel.
Of course.
I think every shift I try to focus on at least one person that I know I helped. It's not always a big save. It could be something really small. It may just be that you reassured a new mother or you gave someone just a positive experience. They're scared to come to the ER. They know it's going to be long. They're worried about what's going to happen. And I really just try and focus in and say, I really helped this person. And that gives me a sense of satisfaction knowing that it wasn't always that you saw the outcome, but that you know you made their day a little bit better. And that's really why I love emergency medicine. And that keeps me inspired to come back the next shift.
I think for me, with this being my second career, I have a lens of gratitude to have the opportunity to be in medicine, to be a PA. I think it's the greatest profession. And again, biased, but I also think emergency medicine is just such an incredible field. And I think on those hard days, having that lens of gratitude and realizing that it is just a privilege to take care of people. For some of them, it's the worst day of their lives. Some people, it's the last day of their lives. Having that opportunity to fill in the gap for that, it's a very humbling, it's a humbling feeling. So, but I would echo what Sarah said, just getting to focus on, giving people access to care. I don't know. I'm very grateful to be here.
All right. Any final advice for PAs who are listening to this episode? They're like, I'm sold emergency medicine. I'm all in. For those interested in entering this field or just growing within it, Tanel, I'll start with you, and then Sarah, if you have any advice, just what would you like other PAs to know if they're interested in joining emergency medicine?
Um, First of all, I mean, what a great field. We would love to have you. But I think the really important thing is PAs anywhere, whatever field you are, we need people to step up. This is our profession and it's our job to protect it. And I would say that people at any point in their career, that get involved. I always like to tell my students, and even when I was starting, you're not too new. We need new perspectives. We need people who have been practicing for 22 years. We need people who've been practicing for 2 years. So I think really just making sure that you step up and get involved in your hospital systems and your state chapters and your specialty organizations. And I think also just on a more personal note, I would say get a mentor early. I think that mentorship is a really important part of kind of going into emergency medicine. And I think it can be really beneficial to grow your career.
I would actually echo a lot of what Tanel said and just expand a little bit on the getting involved. Like any field, even though emergency medicine is always changing and our day to day is different, you start to see the same things. And so you don't want to become complacent or get that burnout. And so thinking about what really excites you, maybe you find that you really like something, some aspect of public health, or maybe you want to be on an advocacy committee. Maybe you think about you're frustrated with some of the legislative issues and that you want to help change that. You can be involved in your hospital. You can get on a committee with the group or company that you work for. And so there's so many different ways to be involved. It's not just about going to shifts. Finding what's important to you and leaning into that will really help you get through those tough days. And so like Tanel mentioned sepsis. So join a sepsis committee. There's a lot of things that you can do to really take your career to the next level. So, of course, new PAs are focusing on the medicine and then kind of think about where can you go next. Um, Perhaps leadership. Maybe you want to be a simple president one day. So, just going to put that plug in at the end here. So,
Well, thank you both so much for taking time out of your day to talk with me. This has been really insightful and eye-opening and very enjoyable to listen to. So, thank you both so much for joining the PA Insights podcast.
Thank you for having us.
thank you.
A big thank you to Sarah and Tanel for joining us and sharing their experiences from the front lines of emergency medicine. Their insights highlight not only how dynamic the specialty continues to be, but also the important role PAs play in delivering high-quality emergency care. If you'd like to learn more about the Emergency Medicine CAQ, including eligibility requirements, exam information, and resources to help you prepare, be sure to visit nccpa.net. Thanks for listening to PA Insights. If you enjoyed this episode, be sure to subscribe wherever you get your podcasts and leave us a rating or review to help more PAs discover the show. See you next time.